Pleura. 1. The pleura is a thin serous membrane consisting of parietal and visceral sheets. Visceral pleura. 1. Covers the lung from all sides and lines the surface of the fissures. 2. Continues from the hilus of the lung to the diaphragm as a fold forming the pulmonary ligament. Parietal pleura. 1. Continuous with the visceral pleura. 2. Covers the internal surface of the thoracic cavity and mediastinum. 3. Divided into costal pleura. Lines the inside surface of the ribs and intercostal spaces. Near the sternum and spine, it continues into the mediastinum. Diaphragmatic pleura. Covers the diaphragm, excluding central regions. Mediastinal pleura. Covers the organs of the mediastinum. Near the lung root, it continues as the visceral pleura. 4. At the level of the head of the first rib, the mediastinal and costal pleura connect, forming the pleural cupula. 5. The mediastinal and costal pleura continue into the diaphragmatic pleura at the bottom. Pleural cavity. 1. A narrow space between the parietal and visceral pleura. 2. Contains a small amount of serous fluid that moistens the pleural membranes. 3. The pleural cavity has recesses that serve as reserve spaces, called pleural recesses. 1. Costodiaphragmatic recess transition between costal and diaphragmatic pleurae. The deepest part corresponds to the middle axillary line. 2. Phrenico-mediastinal recess, a small sagittal fissure at the transition between costal and diaphragmatic pleura. 3. Costo-mediastinal recess at the transition between anterior costal and mediastinal pleura. 4. Vertebro-mediastinal recess located between the vertebral and mediastinal pleura. 4. The right and left borders of the pleural cavity correspond to the lungs. 5. The inferior border of the pleural cavity is 1 rib lower than the lung's lower border. Midclavicular line. Rib 7, anterior axillary line. Rib 8, middle axillary line. Rib 9, posterior axillary line. Rib 10, scapular line. Rib 11, at the level of rib 12, it continues to the posterior border. 6. Anterior borders of the pleura are parallel between ribs 2 and 4. 6. Above and below, they diverge to form pleural field. Superior interpleural field behind the manubrium contains the thymus gland. Inferior interpleural field, triangular space behind the lower sternum and adjacent ribs, contains part of the pericardium directly adjoining the anterior thoracic wall. Mediastinum. 1. A complex of organs situated between the sternum, vertebral column, and right and left mediastinal pleurae. 2. Boundaries. Top. Superior aperture of the thorax. Bottom. Diaphragm. 3. The mediastinum is divided into superior and inferior sections. Border, sternal angle and the intervertebral disc between T4 and T5. Superior mediastinum. 1. Contains thymus gland, beginning of the superior vena cava, arch of the aorta, beginning of the brachiocephalic trunk. Left common carotid artery, left subclavian artery, trachea, part of the esophagus, thoracic duct, sympathetic trunk, vagus, and phrenic nerves. Inferior mediastinum. 1. Divided into anterior, middle, and posterior parts. 1. Anterior mediastinum. Between the body of the sternum and the anterior surface of the pericardium. 2. Middle mediastinum. Contains the heart, pericardium, and main bronchi. 3. Posterior mediastinum. Located behind the pericardium. Contains the thoracic aorta and esophagus. 2. In clinical practice, the mediastinum is divided into anterior mediastinum. Contains the heart and thymus gland. Posterior mediastinum. Contains the esophagus.